Welcome back, everybody. A stroke can happen to one person in an instant, but people with atrial fibrillation are 5 times more likely to experience a stroke. So this week on Midday, we're partnering with the American Stroke Association and University of Utah Health to see the many faces of stroke. And joining us right now is Dr. Ben Steinberg with the University of Utah Health. Good morning.
Good morning.
Let's talk about AFib, because on Monday and Tuesday, Nisha was having conversations. We talked a lot about AFib, but what is it?
That's a great question. So atrial fibrillation is the most common adult arrhythmia that we deal with, and it essentially is chaotic electrical activity in the top part of the heart, and for a variety of reasons is dramatically increasing in rates that we're seeing even in our country and elsewhere.
So managing AFib can prevent a stroke. Kind of talk to us about how that plays into all this.
Yeah, that's a great question and the source of a lot of confusion. The arrhythmia itself, patients with AFib, as you mentioned in your lead, are at 5 times the risk of stroke, and that primarily is driven by clot that can form in the top part of the heart related to the arrhythmia, and in some cases that clot can travel and cause stroke. And so patients with atrial fibrillation, among the things we discuss with them is this increased risk of stroke and what to do to mitigate that.
Now, are you going to know if you have it? What are the signs? Kind of talk to me about how I figure out I'm part of this unfortunate club.
Yeah, this is a great question and also a clinical challenge for us, which is that patients with atrial fibrillation can have a variety of symptoms, such as palpitations or heart fluttering or shortness of breath or a variety of symptoms, but they also can be asymptomatic. And unfortunately, we sometimes don't even detect it until the patient has had a stroke, and we find that that was related possibly to their atrial fibrillation. But the primary diagnosis is made on an electrocardiogram or on some sort of measure of the heart's electrical activity.
Could it be genetic? Like if my father or my mother had that, is it something I need to be a little more concerned about?
We get that question also a lot, and the short answer is not directly. It's complicated, like a lot of things in medicine. There probably are some genes that affect it, but just because a family member had it does not necessarily mean that you're going to have it.
Okay, let's talk about your work at the University of Utah. You've been here for a couple of years now.
Yes,
talk to me about what you're doing up there to treat and prevent this.
Yeah, so we have a multidisciplinary approach, as many centers do, to atrial fibrillation, because it can be very challenging and there are many facets to the treatment. We primarily focus on 3 or 4 tenets, which is 1, to address any risk factors that have contributed to atrial fibrillation. 2 is this big topic of preventing stroke or treating stroke that has occurred. And then 3 is managing the symptoms and preventing other adverse consequences of atrial fibrillation. So we work with not just the heart rhythm group, my group, but general cardiologists, nutritionists, people in the sleep apnea group, people treating high blood pressure and diabetes, our heart failure group, God forbid the patients also have heart failure, and then of course our neurologists for the patients that have had a stroke, etc. And there are a variety of different treatments as well.
Do you like your job?
I do.
There's a lot going on.
There is a lot going on in atrial fibrillation these days.
A lot going on and a lot of good that can happen. Thanks so much for joining us today.
Pleasure.
We appreciate all the work that you're doing at the University of Utah. And if you have any questions about the topic, well, we want you to go join us online at abc4.com. When you get there, we will connect you with more information, not only from the University of Utah, but of course the strokeassociation.org. And we'll be right back.